Hi, I'm Dr. Evita Fernandez, Consultant Obstetrician, Fernandez Hospitals, Hyderabad.
Hi, I'm Subarna Ghosh. I'm an academic, a public health activist, and the founder of Rewrite.
Hi, I'm Shweta Marathe. I work as a research officer with Sathi, Pune.
Hi, I'm Dr. Kurush Pagdiwala, practicing obstetrician and gynecologist in the city of Mumbai.
Hi, I'm Dr. Durusha, Director Gynec World Mumbai, the Center for Women's Health and Fertility.
There's no denying that in India we are facing a crisis. Childbirth, in fact, is facing a crisis. There's a lot of medicalization, there's a lot of interventions, and our C-section rates are rising. I'm working in a district hospital with the government, and private hospitals are cruising at 90%. And in the district hospital itself, our primary gravity, I'm ashamed to say, we did our statistics, we found that the doctors are cruising at 73% for primary gravity.
In spite of all the developments, all the safeties of anesthesia, if you take 100,000 patients, you will see that C-sections are different from vaginal delivery. Wound infections and multiple other things, they would show themselves up if we study maybe 1 million women undergoing C-section and 1 million women undergoing vaginal birth.
If there is a lady asking that, no, I don't want to go through a normal delivery because I want a C-section, I'm scared of the pain, I'm whatever are her issues, we would counsel her, we would tell her, you can get an epidural, but let's face it, how many places epidural is available? Yes, it's available in certain hospitals in the city. It's not available everywhere. So what happens to that woman who's scared of having a normal delivery only because she's having pain? So she'll demand a section.
In urban areas, C-section rate number is double than that of the rural, and in private sector it is 3 times more than that of the public sector.
I think what we are concerned about is how does a hospital find its appropriate number? And I believe we can only do that if we audit what we are doing. If we have the political will to do that, I feel we can all work together towards helping mothers, delivering babies, and finding the appropriate incidence for our area of work.
I absolutely agree on that, and that is where the whole ask to declare the number of cesareans that institutions are conducting comes in, and that could be a huge thing to make informed decisions. As someone who will walk into a facility, if I know what are the rates, I can make an informed decision.
Every hospital should have its audit committee. We used to have it at the Wadia hospital, where every unit was called in, why has your section rate gone up? We had to answer those questions, right? So the question is now, when we are talking about ethics, I have been on the ethics committee of the International Organization of Gynecologists for 6 years, and I have helped to develop many ethics committee guidelines. In India, unfortunately, Ethics guidelines are never sort of legally binding. It's not legislated.
Let's join hands. Let's bring in a form of audit which is mandatory. Start with that, because unfortunately we need the stick quite often, and if that becomes mandatory, it's a beginning. At least to start bringing down our cesareans, because then we are forced to look at our data.
One stakeholder in this entire thing, apart from Foxy, are the women who are undergoing the experience. So every time we quote data and statistics, which is the quantitative part of it, we need to just go back to the qualitative aspect and keep taking in-depth interviews, ask women what they feel. I think we will all gain so much if we can go back to the women who have delivered and ask them, how was your experience? If as doctors, as researchers, as policymakers, we all need to go back to the community who's receiving the care and ask them what do they feel about it. That way the quality of care will automatically improve.
And I feel now with the childbirth classes, when a woman is given the knowledge that, particularly if she's afraid of pain, and we give her alternative choices that she can have, that brings down the fear. And her desire to have a normal birth, because you've empowered her with that confidence, her need to ask for a C-section then comes down. That's an area that we obstetricians have not really gone into much. We need to work with childbirth educators. And the second, when you have midwives, they have all the time to devote to that mother, virtually one-on-one. So that constant support, and Cochrane has shown the presence of a constant support or continuity of care, the woman's chance of having a C-section is less. Her desire for a C-section is also less because of this tremendous support.